At least 1.2 million people use self-directed home and community-based services. We interviewed 36 people using self-directed Medicaid HCBS to find out how they stayed safe during the pandemic. People using self-directed HCBS have control over hiring and supervising their workers. During the pandemic, participants set rules for workers, including don't come to work if you're feeling sick. Sometimes people noticed their workers were not following COVID guidelines. Participants warned their workers that they may need to fire them if they continue to be unsafe. During the pandemic, many individuals hired family members or close friends in states that allowed this. Participants trusted people close to them to prioritize their safety. When carers got sick or exposed to COVID, sometimes participants had to go without care. Hiring family members helped prevent some of these service gaps. People who are self-directing are often less connected to formal agencies. This made it difficult for these participants to find information and resources. Even if they had limited income, many participants had to buy their own masks and gloves. Accessing the vaccine for themselves and their workers was confusing and difficult. These are policy areas we need to improve for the future. Despite some of the difficulties imposed by the pandemic, people felt much safer when they had choices about who came into their home and the safety precautions they took. This is some of the first research about experiences of people self-directing home and community-based services during COVID-19. This study was conducted by the Community Living Policy Center at Brandeis University with support from the Commonwealth Fund and the Administration for Community Living. For more information, visit www.communitylivingpolicy.org.